Hello everyone, welcome to Elder Health Science. I'm Matthew Fan. Wonder if we eat much processed meat every day? According to research findings from US, for males who are red meat eaters and processed meat lovers, they will have a much greater risk of having prostate cancer. Also, there's an increased chance for cancer to be worsened. Doctors believe that there's a close relationship between cancer and red and processed meat consumption. Studies have shown that the risk of having colon and breast cancer can be raised because of this. Apart from this, pork, ham, beef are also examples of red and processed meat which also induce arthritis. That's the reason why arthritis patients should avoid consuming them. By the way, do you guys know what are the 3 cancers which kill the most number of people in Hong Kong? The answer is lung cancer being the first one, followed by colorectal cancer and breast cancer. So what would be the ideal diet plan for people who have cancer? Let's take a look in this right now in today's Nutritional Therapy Insight.
In 2006, statistics in regard to cancer in Hong Kong revealed that for those who are above 65 years of age, the 3 most common cancers among males are lung cancer, liver cancer, and colorectal cancer. On the other hand, for females, the top 3 cancers are colorectal cancer, lung cancer, and breast cancer. It's such a dread when we hear the word cancer. If we are unfortunately diagnosed with cancer, we should pay more attention on the diet and nutrition, because nutritious diets help patients to get prepared for chemotherapy, which fight against the disease. During chemotherapy, patients' body cells will experience a great deal of pressure. The body needs large amounts of nutrients to repair all the cells damaged by the chemotherapy. In addition, the body also requires nutrients to maintain the functioning of normal cells. If there's not enough nutrients for normal function, the body will decompose the stored fat and muscle tissue. Patients will experience weight loss. Because of this, weight loss will prolong the time for chemotherapy and also increase the mortality rate at the same time. In 1983, the research has already indicated that antioxidants like keratin and vitamin A from natural sources help to improve the survival rate during chemotherapy. Antioxidants can neutralize the harmful free radicals. Free radicals are mainly caused by ingestions of high-fat food. Smoking or drinking, contact with environmental pollutants, carcinogen, heavy metals, or radiations can also induce our body to produce free radicals. These free radicals are one of the causes of cancer. Oil derived from fruit and red palm tree contains natural keratin, includes alpha and beta types. It also has natural vitamin E, includes tocopherol and tocotrienols. If cancer patients and those who are during recovery can start their dietary treatment by replacing common cooking oil with natural red palm oil or ascorbic astaxanthin from natural cream lecithin. This can assist the uptake of sufficient nutrients and antioxidants. First, help fighting against cancer cells.
Hopefully, cancer patients can get some useful advice from our nutritionists. Other than cancer, bone and joint pain is another struggle for elderly. There are products in the market which use fish oil to ease some kind of like bone and joint pain, but there are actually other kind of fatty acid which might do help as well. The name is chelated fatty acid, and there are many research supporting it to use on smoothing like joint and bone pain. So let's take a look at some of the experts and see what they say about this new kind of ingredient.
Basically, all our CFA are basically non-GMO, and all our materials are basically meeting the US standards requirement. In the course of our research, basically what we using the CFA to deal with anti-inflammation, we have come up with two formats of applications. One of the format is oral. That means you put in oral because inflammation is usually from the internal part of the body. So therefore, the oral, when you consume orally, basically it deals with the inflammation. That's one of the factor. However, we also, in the course of research, we found that we develop it into a topical application, which is in cream format. The reason why many people who suffer from osteoarthritis, usually they are in pain right now. When you do oral, it's not immediate. It takes time to reduce the inflammation internally. But with that pain on the osteoarthritis on the joints area, people want to find immediate remedy. Whereas when you put in topical, it addresses directly. When you put it directly, you find a relief coming in almost within half an hour. So it helps the consumers to have a better quality of life.
If you are interested in using chelated fatty acid to help solving some of your bone or joint pain, please consult your own health professionals. Alright, let's take a short break now. There are still some other scientific reports awaiting to share when we get back, so stay watching.